Good morning, everyone. Welcome back to our second day. My name is Carolyn Daher, and many of you might know me because I've given you things to do for the conference in the spirit of co-creation. And those of you I don't know, I might meet you over these next couple of days and give you things to do. So we just wanted to start off the second day by welcoming you and going over a few housekeeping items for today. Today, we have a very full day of excellent programming again. This is going to be our busiest day. And so this afternoon from 4:30 to 6:30, we have our special site visits. These are the visits that the city has put together so that you can see in person their projects to improve health. In order to participate in these site visits, you have to sign up at registration desk this morning. By the end of the coffee break, we have 3 different visits that you can participate in, and they either leave here or from the botanical gardens. If you decide that you don't want to go on a site visit, we have a full afternoon of really special workshops that will be going on at our 2 different venues that you'll find listed in the program. We had a huge number of requests to participate in the city tour this afternoon. So we've had to make a change in the schedule. Those of you who signed up for the tour in advance got this card. We have changed the time from 4:30 to 6:30. So no matter what it says on your card, the tours will now be leaving from here at 6:30 in the evening. So please make note of that and tell your colleagues who might not be here just yet this morning. We'll have a sign up there as well. So we hope you enjoy that. If you've had a travel delay or for any reason missed your sessions, please contact the speaker desk and we will work to find you a new slot. For anyone who's lost any items, you can visit the reception, the registration desk where we'll have our lost and found. Please check your bag and make sure that it's your own. We've already had a few cases of mixed up conference bags. If your bag starts ringing, that might be a good sign that it's not your own. And we have a very packed agenda today so that we appreciate if you can be on time for your session. So we want to thank again the ISUH team, our sponsors and hosts, and Nathalie and everybody who's working to make this conference possible. We hope you enjoyed today. So now I'm going to pass over the mic to Olga Mayoral, who's the Deputy Director of the Botanical Gardens, one of our hosts of the conference, so she can open today. Thank you.
Hello, good morning, everybody. And although I know that the rector from the University of Valencia already gave you a warm welcome to our university, I'd also like to welcome you to the Botanical Garden and invite you to come to the sessions and workshops we're having there. And if you've got a little bit of time in between just to walk around and take a look at this historical site, which is just in the center of Valencia. It belongs to the University of Valencia, which is the biggest in our region and the oldest. We are more than 500 years old. And from the beginning, our university had botanical gardens in different sites. It was moving around. And from the beginning, these botanical gardens were linked to health issues. They were always really near to the faculties of medicine. Future doctors needed to know which plants they could use to extract the simples and the drugs to elaborate medicines. So botanical gardens, since the origins and plants, have been really linked to human health. And they're also linked to the health of our environment. So I think there's much to see in the Botanical Garden related to the issue of this conference. And I'd also like to tell you that the Botanical Garden, just a tip of information, was closed to visitors for centuries, and it was just a classroom to learn about plants. But in the 60s and 70s of the last century, it opened to the city, which is something we really like. And now the city considers the Botanical Garden an important part of the city. It's one of the biggest green areas we've got up because, you know, down we've got the old river bedside, which is a very big park that crosses you along the city. But the botanical garden is up, and it's a place where people like going with the child. You'll see many children, many primary school children, and it is also a university space. So we also use it to give our classes, to teach, and it is also now linked to human health, because we are developing different investigations, different research on the influence of green areas and green spaces in our health, you know, about this possibility of getting a green bath, going into a forest. And there's a lot that is being said from the psychological point of view of how green areas can help us. And of course, it is also a site that is like a pilot that we can use. We can imagine how many botanical gardens we've got around the world. And these places are pilots where we can see which species work well in that area. And now with climate change, we really know that we need more green areas in the cities to make sure that the temperature is not so extreme. And we need to select the species to plant in the rest of the city. So here in Valencia, we think that our botanical garden gives information to the whole city of which species work well in Valencia. And this is happening all around the world. So now many botanical gardens have signed an alliance to work together in relation to climate change issues. And one of the research topics is exactly that: which species are we going to be selecting that will be useful for the cities that will live for many years. And that's a very promising new topic of research we are quite interested in. With this information I give to you, I just would like to remind you that botanical gardens are also ex situ conservation sites. We invented them first to learn about plants. Then we invented them because we needed to preserve plants biodiversity out from the natural areas, because we tend to destroy the natural areas and we need them. And in our botanical garden, we've got the seed bank of reference with all these species in the Valencian region. So it is also a place that is devoted to preservation of plants biodiversity, but it is also a place to communicate, to teach, and it is a place where research and plant conservation work together. So it is a very interesting place. You will be crossing through the building, and I just want you to know that in that building, there are many things that are being done. You're going to be visiting the plant collection, but in the building, we're making research on very different issues, and we will be very welcome if there are researchers of other countries, other areas that study things related to these issues. We'll be delighted to collaborate with you. So thank you very much for being here. Thank you very much for choosing the University of Valencia and the Botanical Garden as an interesting place to host the conference, and welcome.
Thank you so much, Olga. Those are great inspiring words as we think about our time together in the botanical gardens over the next week. And Olga was one of the biggest reasons that we were actually able to do it at the botanical garden. She personally really made that happen for us. So thank you again, Olga. So hello, everyone. Day 2 here. Welcome to everyone who's joining us this morning in person, and also to those of us who are joining us virtually. I don't know about you, but I'm feeling so energized from seeing everyone together from around the world, thinking about the ways we can improve urban health. So this morning, we're going to be talking about transforming urban environments for health. And I'm so delighted to be here with you all among this absolutely phenomenal group of change makers that we have this morning to talk about how we can all use the various skills, perspectives, and resources that each of us bring to the table to work together to reimagine and to reshape our blocks, our neighborhoods, our public spaces, our communities, and even our cities in ways that explicitly support and promote health. As you all have heard over the last 24 hours, the ISUH is especially interested in the ways that we can translate the vast research and evidence that has been gathered over the last 2 decades on the ways to build healthier, more sustainable, and more equitable cities into action and positive impacts for residents, regardless of where they live, where they come from, how much money they make. And my goal for this session is that we can offer some practical examples of approaches and strategies that anyone can use, whether they're coming from the perspective of academia or government, a multilateral, a private company, a nonprofit organization, or even a philanthropic foundation, to encourage transformative changes that can improve resident health, well-being, and equity. So we're going to start first this morning by hearing a few opening words of inspiration from today's special guest, Anna Siprikova from the Global Designing Cities Initiative. And then we'll get to learn about the many ways that Nathalie Röbbel of WHO, I hope I got that semi-right, and Sarah Skenazy of Google Health, Rowena Estwick of Impact on Urban Health, Louise Vogel Kielgast of Gehl, and David Erickson from the New York Federal Reserve, the ways that they are working to transform urban environments to improve the health and well-being of residents, all coming from these different entry points, but moving together in the same direction and with one unifying goal, which is to create even more urban environments that support holistic health, well-being, equity, and prosperity for all residents. So we'll then get a chance after that to dig a little bit more into the how with an interactive discussion with the panelists and from the audience if time allows. So really excited for this great conversation. Thank you all for being here, for getting up early. I hope we can energize you with this initial conversation for the rest of the day. And with that, it's my pleasure to introduce Anna Siprikova. So Anna joined GDCI in 2018 to work on the Streets for Kids program. She created a supplement to the Global Street Design Guide for that. And she is an urban planner by training and specializes in public space design, management, placemaking, and civic engagement. She has a passion for working with people in communities to create public spaces that they love. And prior to joining GDCI, she worked as a senior project associate at Project for Public Spaces in New York City, where she contributed to the Southwest Airlines Heart of the Community program, an amazing program to improve underutilized public spaces throughout the United States, which is actually where I first got to meet Anna. So Anna, there's a lot more actually that she's done, but please come up here and help us kick off the discussion. The floor is yours.
Thank you so much, Giselle. I almost forgot how much work I've actually done in the past. And thank you everyone for being here this morning. So as Giselle mentioned, I'm trained as an architect, an urban planner, but I do consider myself a practitioner. But I think after attending this first ISUH conference, I should really treat myself as urban health professional, because the work I do daily is focused at Global Designing Cities Initiative is focused on transforming streets and making them safer, comparable, and more accessible for children and those who care for them. And with that, I want to share some alarming numbers with you to kind of set the stage for this conversation, but there is some hope. So as you might know, the childhood, the way it's experienced right now, it's primarily an urban experience. Over 60% of the population of urban cities will be below 18 years old by 2030. So the majority of our citizens are actually young children and young adults. Yet, these childhoods are unfortunately far from being joyful, comfortable, and worry-free as they should be for children to develop. And we are unfortunately killing our kids slowly. And as we've heard yesterday, all of the effects of air pollution that's coming from like overusing the private vehicles from all other sources takes away almost over 100,000 lives yearly. There's a lack of physical activity that contributes to all range of diseases, and you know better than myself as you work on this how terrifying it is and how less kids and adolescents move in our cities. They walk less, they cycle less. It's unsafe in most of the places, unfortunately. There's all of the challenges coming with mental health, depression. Again, as I've learned in the sessions yesterday, globally in many cities, especially affecting young girls and people with in underprivileged communities. And we are unfortunately killing our children fast. Every day, 500 children are being killed in traffic violence. The good news is this is preventable. We can change it by focusing on design, merging what we're hearing today from the research, from practitioners, and really kind of redesigning the streets. And even better news is that we do have this support from the mayors and from the cities that, at least for GDCI, have been endorsing the Global Street Design Guide that sets the new standards of how the urban environment can be designed. So again, I just want to kind of that these numbers sink in with you for a moment, because I think this is something we don't really kind of pay kind of needed attention daily, and it kind of becomes the norm, but it shouldn't. And really looking forward for this panel and learning more how we can fully transform our cities to be healthy and happy for everyone. Thank you.
Thank you, Anna. Thank you so much for helping us think about the ways that streets and public spaces can and should be designed to improve road safety. And in fact, that there should be zero traffic-related deaths, especially for kids. They are completely preventable. Our youngest and also our most senior residents, they're so important to think about the ways that we can actually design to improve their health and to prevent the accidents that we see happening every day. It is not something that needs to happen. It's really important framing for the rest of our conversation. So now I would like to invite Nathalie Röbbel up to the lectern. Nathalie really needs no introduction, as she serves as our fearless lead for WHO's work on urban health in the Department of Social Determinants of Health. Prior to this, she was leading WHO's work on air pollution and housing in the Department of Environment, Climate Change and Health, and has a very long and very impressive resume of positions and accomplishments that led to this important new role at WHO. Ms. Röbbel holds a PhD from the University of Bonn. Nathalie, come on up. Over to you to discuss the ways that you're spreading the urban health agenda through all the departments of WHO and through your partners.
Thank you very much, Giselle, and good morning to everybody. Buenos dias. Big thanks to all of you to have made it so early. So thank you, because we know that it's challenging when you have these opportunities to get together after so many years and catching up, right? So I guess that the night has been pretty long. So thanks again for being here. Just to start, sorry, I'm trying to. Which tool should I use? So maybe just to start, that obviously WHO has not been working on urban health only in the recent year. It's a long-standing tradition. WHO has been working with many partners in this room across the globe on urban health through a variety of entry points and projects. And certainly the growing consensus on the importance of urban health is visible across different sectors, disciplines. We see here that most recently, even within the UN system, the role of urban health within global processes is really getting traction. Yesterday, we discussed the importance of air pollution and climate change on health, in particular at the very urban level. And very recently, in preparation of the forthcoming COP, you see that under the presidency of this current COP, a new initiative has been set up on sustainable urban resilience for the next generation. Even at the broader scale within the UN system, the local 2030 agenda is really trying to bring together the efforts of the United Nations system to act locally for development, and health is predominantly playing a role. And then obviously you see a variety of initiatives, being it from academia, being through city partnerships that not only are getting together for development or urban matters in general, but actually are putting the health cause at the very, very front, like the Healthy Cities, Healthy People movement. And certainly then yesterday, we also heard from our colleagues from the World Bank on all the efforts that are currently being made on the development of the Healthy Cities report. But I would say that most importantly, we see that cities are actually taking the lead. We see more and more cities who are actually identifying the need of streamlining their policies, their mechanisms to achieve health for their own populations, but even more broadly for global health in general. So this is just a bit of a preamble saying that WHO has been working on urban health for decades. There is an increased growing consensus on the importance. However, this being said, I think that there is the understanding that maybe we are still functioning a little bit in a siloed approach, in the sense that we are seeing, identifying key priorities. Yesterday, we discussed climate change. More recently, obviously, through the COVID-19 pandemic, the role of cities in the emergency preparedness and response has been coming to the surface. But there is the recognition that if we want to move the agenda on urban health, we certainly need to continue providing technical expertise and support on very specific public health priority matters. But at the same time, we need to bring this together. So what I would like to do in the next couple of minutes is just to highlight 3 different ways that we in WHO, together with a multitude of partners, are trying to consolidate and have a holistic approach to urban health. The very first one is that we are currently developing a strategic guide for urban health, which really aims at having an integrated approach. So the idea is, first of all, to clarify terminologies. For national and local governments, very often, there is a need of understanding, what do we understand by urban health? How does it differ maybe from healthy cities approach, or sustainable cities approach, or smart cities approach? Where is health there? So there is a need of clarifying what we are actually talking about. But we also need to make the case and having a better understanding, what is actually the epidemiological case, right, for working on urban health, for addressing urban health? What are the costs, the implications? So there needs to be a mechanism that makes a compelling case for this integrated action, to link it to major policy priorities and to identify clear priority areas, entry points, and have to this then supported by a large number of case studies and examples and recommendations for national and local governments. So all this to say that the strategic guide is going to be one of the flagship activities on urban health in WHO for this year and in the coming year. And the approach that we are taking is that we are, on one hand, working on key issues that are relevant for the urban agenda that we're actually discussing across the conference in these last days. The burden and the potentials of urban health, the economic case, as I was saying, or the epidemiological case, but also what are the key discourses that need to be looked at? How does it link to the Sustainable Development Agenda? What are the implications of urban health policies for equity? How does it relate to the COVID response? And then actually having also a bit of a knowledge about the history, the concepts, and the definitions. On the other hand, we're going to be initiating a series of policy consultations with the understanding that if we want to develop a holistic approach to urban health, there needs to be some cross-cutting themes that need to be taken into consideration for shaping an urban agenda broadly. In these 4 elements, and colleagues in the room, I'm sure there are a couple of you who will recognize this because this is based on, existing work with several colleagues, is that the 4 main entry points that we have been identifying so far is that observation and analysis of data, governance and financing, innovation and partnership and participation are actually the key drivers, the key entry points that need to be integrated and actually should be leading this integrated approach. So to conclude on this first example, I would just to maybe draw your attention to the fact that we are currently having an expression of interest. You can see it on the WHO website, and if you're interested, please come to see me afterwards, where we are seeking actually expressions for colleagues, institutions to be working actually on those policy consultations. So if any of you is interested, please come to us and we will be providing you with more information. Very briefly, the second example is that it is obviously not sufficient to be developing frameworks or strategies, or strategic guides. It needs to be followed with concrete implementation on the ground and support on the ground. So again, while WHO has been working on capacity building in very different topics relevant to urban health, there is so far the need of bringing all this together. So WHO is currently developing a broader capacity development program on urban health, which is a learning initiative to help develop an integrated and coordinated approach. And I think what is important here is that, again, you can see the priority areas. They do match actually more or less the strategic priorities that we have identified for the strategic guide. So when we talk about capacity building, we understand obviously the need of having in-depth knowledge on very specific topics, but there is also the need of having competencies on actually how to work across the sectors, what actually priority areas would need to be strengthened at the very local level, but also at the national level to provide support. So with this capacity development work, we want to really increase the knowledge, the abilities, and the competencies to really enhance a positive change and to really have a collaborative, interdisciplinary approach to urban health. And for this, we are not only aiming at developing an urban health training course, and please regard this as very draft. So this is just, to show you a little bit our way of thinking. Please don't quote us so far. But on the other hand, what I would like to highlight is that we are looking at core capacities. We want also to provide cities, leaders, professionals with a tool that would help them to assess where they stand with their own capacities as regards to urban health policy making. Where do they stand? What is the need? And by doing this, this will actually implement and influence the content of the training program. And the third example, and then I'll stop with this, is that yesterday, Carlos, in his opening remarks, has made reference to a joint collaboration between the International Society of Urban Health and WHO on developing a research agenda. WHO, one of the core functions is to strengthen and to shape research on broad public health issues. So in collaborations with the International Society and with a lot of partners in this room, WHO has developed a research agenda, and actually watch out on the 31st of October. So it's World Cities Day, Monday next week. The research agenda will go live. And you will see that these are obviously just like a snapshot. There have been 4 key priorities that have been identified that you can see here. But underneath those priorities, you have a large number of very specific priorities that have been identified. And I'll just keep imposing on 2 as an example. Yesterday in the presentation in the plenary, we discussed about the role of mental health, to look at mental health when we talk about urban health. Remember, we were talking about the broad definition of health and the role of mental health. So one of the key priorities that has been identified, one of the key lacks, this is just one example out of many, is that when we look at urban health, there is still a need for doing specific research on the links between urban health and mental health. The second is about having more research about financing schemes and their impacts actually on health outcomes. So what programs, how do programs function to support urban health policy making? How are they evaluated, and what's going to be the implementation? So these are just the headings. The research agenda will give a bit of a hint about very specific entry points, and WHO will be continuing to work with regions and partners to implement it in countries. And with this, I would like to stop and thank you very much. So, sorry, pardon me, this is just to show how everything is linked together. Obviously, all these pieces can't be seen as, individually, but in view of time, I just stop here and thanks for your attention.
Thank you, Nathalie. Thank you so much for showing us the many ways that you're setting the different research agendas and building new capacities and opportunities to advance urban health through research translation and training, but also I thought it was really interesting that you were talking about equipping cities themselves with the tools and the research and evidence that they need, and also offering technical assistance and common language or even data to help them support, help local authorities really take the lead on this. And also that idea of aligning agendas to advance a more integrated and holistic action on urban health, all really fantastic ways that WHO is helping to support this effort. So thank you so much. Well, next, I am so excited that we have Sarah Skenazy here from Google Health. Sarah is an urban planner and a public health practitioner committed to quantifying and increasing the economic and social benefits of built environment projects to improve public health and well-being. She works at the intersection of urban design and community development with the central question of how cities can be designed to adapt to climate change while providing the health of economics and people. Technically, she is a technical specialist in health equity and social determinants of health at Google Health, but she'll tell you all about what that means. She gets to wear many hats and do really interesting things. And she has graduate degrees in city and regional planning and public health from the University of California, Berkeley. She's worked as a researcher, as an analyst, as a designer with Perkins and Will, for example. Some of you architects and planners will know them well. HOK, nobody's ever heard of them before. The Public Health Institute and the University of California, Berkeley College of Environmental Design. Sarah's perspective is so encouraging because she has managed to find a way to advance urban health and equity within the, I checked this yesterday, more than 160,000 person machine of a massive company like Google, with the rare gift, I'll say, of funding and data and technology. So tell us, Sarah, how are you going to be using Google Health's vast resources to transform urban environments to improve health in your work?
Is it okay if I close this? Good morning. No. Maybe. Stack some computers. All right. Oh, it's okay. There's not that many. Good morning. I am so excited to be here today. I'm also pregnant and very jet lagged. So thank you for supporting me in referencing my notes to ensure the factual accuracy of the remarks that I want to share. Our prompt this morning from the wonderful Giselle is to share our work to transform urban environments for health. I'm going to use the term urban environments somewhat loosely, perhaps predictably, allowing it to include both physical environments and the broader social and environmental contexts through which people generate and receive information about the world around them. My proposal is that we treat information about and derived from urban environments as a vital input to the creation of healthy city infrastructure. So as Giselle mentioned, I'm an urban planner as well as a public health practitioner. And I began my career working on the co-creation and development of physical infrastructure projects with the central question of how places can be designed and crucially can evolve over time to work towards the elimination of racial and socioeconomic disparities in health. For me, that has meant an ongoing dual investigation into what drives health outcomes on the one hand, and to what types of policies and infrastructure can support the equitable distribution of health benefits on the other. I have found myself often as the sole public health person in rooms full of architects and structural engineers, making the case for housing as health infrastructure, for transportation as health infrastructure, for affordable and nutritious food, for workforce development, all the things we need for healthy communities, and that people that are the least likely to have access to need the most. I cannot begin to tell you the number of times I have looked to inspire a room with the World Health Organization definition of social determinants of health. It is a joy to get a little more technical today because I trust I am in the company of fellow practitioners. Working at a technology company as a healthy infrastructure person with an SDOH lens may seem like a strange fit, but working at Google has helped me expand my own mental model of health drivers, in particular, access to actionable health information for individuals, and vitally, what I'm going to be speaking about today, for public health entities. But let me show you what I mean. So Google's mission is to organize the world's information and make it universally accessible and useful. When most people think of Google, they think of Google search. But to build Google search, the organization needs physical places and spaces for its teams to do their best work. When I joined Google in 2018, I got to join them in wrestling with big questions in infrastructure and health to explore together the opportunities to bring an SDOH lens to physical infrastructure development across the global real estate portfolio, but with a special focus in the South Bay area of California, where I'm from. The real estate development team works to design sustainable, inclusive places where local communities and Google can thrive. In practice, what that looks like is that in addition to building offices, the organization is asking really interesting questions about what it means to be an anchor institution and how to co-create healthy infrastructure in the cities and regions in which it operates on a very long time scale. My starting scope was with the healthy built environment typologies that you might expect: mixed-use neighborhoods, active mobility networks, universal design, carbon-free buildings, tree canopy, restored habitats, all the best practices stuff that we talk about all the time. This is a rendering of one of Google's anchor campuses in San Jose, California, one of the 10 largest cities in the United States. Our projects in the South Bay will include millions of square feet of residential, retail, and other community uses, and more than 15,000 residential units as part of Google's joint housing commitment, a particularly exciting point for me in a region with such a complex housing crisis. So I was happily working on SDOH with my team of stellar urban planners, architects, community development folks when the COVID pandemic stretched across the globe. I and many other public health practitioners across the company came together to contribute to the organization's pandemic response under the banner of Google Health. Google Health is our company-wide effort to help billions of people be healthier. Pre-pandemic, the group's big investments were in the fields of healthcare and life sciences, including a ton of work in AI for imaging and diagnostics and clinician tools. In 2020, when I joined the team to help out with COVID, I had to quickly adapt my own understanding of SDOH to apply to infrastructure that is not only physical. 3 out of 4 people go to Google search seeking health-related information before they contact the healthcare system. Hundreds of millions of people every single day. Information, too, is a determinant of health. And information that is accurate, timely, accessible, and supportive of action is vital to support the broad ecosystem of public health entities in their work to transform environments for health. During the pandemic, we invested in helping combat COVID-19 with mobility and vaccination insights. These tools were created as a direct response to what we were hearing from public health officials, that the same type of aggregated, anonymized insights we use in products such as Google Maps could be helpful as they made critical decisions to protect community health. I'm going to speak briefly now to 2 of the over 200 new products, features, and initiatives that made up our pandemic response, because I think they're good examples of how information about complex health topics make up the environment in which those of us who work to support public health as part of our mandate or our mission are operating within. So first, the vaccination search insights. This tool shared timely and localized data about what information communities were seeking when they came to Google search, so that public health agencies could tailor hyper-local communications campaigns to people that were not yet vaccinated. The tool was meant to help officials and researchers explore vaccine-related concerns and information needs by displaying trends representing relative interest across different search categories and questions. We also complemented this information for agencies with tools for individuals themselves, surfacing free vaccination locations on Google Maps with office hours, route options, and availability. So viewing information as a determinant of health means helping public health entities from the WHO down to your city health department all around the world get the information out to people that is going to resonate and remove barriers to action. For my urban planners in the audience, my second examples are community mobility reports, which provided insights into how travel behaviors changed in response to shelter in place and other policies aimed at combating the pandemic. The reports use aggregated, anonymized data to chart movement trends over time by geography across different categories of places, groceries and schools, neighborhood services, pharmacies, clinics. The reports are available in 135 countries and 68 languages and have been downloaded more than 30 million times. Ultimately, understanding not only whether people are traveling, but also trends in destination typologies can help officials design guidance to protect public health. For example, this information helps officials shape recommendations on business hours, delivery service offerings for clinics and pharmacies. And similarly, because clustered visits to transportation hubs might indicate a need for transit capacity in order to allow commuters and travelers room for social distancing, these reports help transportation authorities adapt their operations through a health protection lens. So these are ways that we can use timely data insights about urban environments and highly localized health concerns to support decision-making on service provision, infrastructure adjustments, and policy promotion to support urban health. So while information is becoming increasingly available, the quality of that information, its relevance, and its helpfulness impacts health outcomes and progress in health equity. Today, as we continue to conceive of a time when COVID-19 is endemic, we must turn our attention in earnest to other global challenges that the pandemic masked or even exacerbated. Contributing to a healthy information ecosystem will continue to be a major part of how Google hopes to use our products, our technologies, our expertise, focusing on areas that align with the United Nations Sustainable Development Goals, such as mental health and climate change. Our teams are taking the lessons learned in the pandemic and exploring how they might be helpful for urgent topics in environmental health, like air quality, extreme weather events like floods, fires, and heat waves. If you're a public health practitioner, a researcher, a communicator, a community advocate, I humbly invite you to look to Google as a partner in the application of information insights to support your public health efforts in the social and structural determinants of health. And I will be here all week.
Thanks so much, Sarah. That's such an interesting idea to think about, information as health infrastructure. Honestly, it's something that I haven't thought that much about. So now for the rest of the days, I'm going to have that in the back of my mind. I'm sure many people here will too. And so also thank you for advocating for public health when you're in rooms full of built environment professionals. I also understand how that is, but we need that to be happening. And also within, this company that has such a massive and significant physical footprint actually around the world that impacts, I think it's amazing. There's so many campuses all over the world, and it actually impacts people who are working in all different countries if they can actually, have campuses that support their health and well-being in a more substantial way. So great that you're thinking about that. And then I also thought, of course, this viewing health information, this idea that you brought up of having health information out there and Google helping to put it out there could actually be something that WHO or other local public health authorities could use to reach audiences that are outside of the traditional health systems or channels. So maybe you'll have some people trying to partner with you, but that would be amazing. I'm sure many of us would love to get some information up there at the top of the Google search results. So yeah, thanks so much. That's fantastic. So next, we are absolutely thrilled to have you here with us, Rowena. Rowena Estwick is the Director of Diversity, Equity, and Inclusion at Guy's and St. Thomas's Foundation. They're an independent foundation based in London with a focus on backing people and ideas to dive into more equitable health and to drive more equitable health, and there are different specifically focused brands within the foundation, including Impact on Urban Health, which their ultimate goal is achieving global health equity. That's a big goal, but glad that we're moving towards it. And they're doing this by tackling health inequities and inequalities in inner city areas. Also based in London, they fund and they test practical and innovative solutions and share their learnings with others around the world. So we are so grateful for Impact on Urban Health sponsorship of our conference this year. And we're so privileged to have you, Rowena, to speak about the work that you're leading to drive equity and inclusion in urban environments. Please come on up.
How do I do this? Is it gonna? Okay, I'll look that way. Okay, cool. So thank you for the introduction. Thanks for having us here today. I am not pregnant, but I'm also going to use my notes. So thank you for the patience on that. So yeah, I work at Guy's and St Thomas's Foundation, which is one of the larger health foundations in the UK. And diversity, equity, inclusion may seem like something that is mainly an HR function in organisations, but as an organisation that focuses on health equity, we see it as really critical to our mission on trying to achieve that. So we think about equity as how we embed it not only in the structure of our organisation, but also into the work that we do externally with our partners. So before I get into the question of how we are transforming it, we held a workshop yesterday and we asked people in the workshop to tell us what they thought health equity is and what it meant to them, to kind of get a different idea of what the different perspectives were. And it's clear to see that there are lots of different ideas on what that means and what that looks like, depending on where you are in the system. For us, when we talk about health equity, we think about how the context of cities are, what that means for equal access and opportunities that cities have and offer to protecting the most vulnerable in society and from the harmful effects of the health impacts. And we believe that reshaping cities so they are healthier places for everyone, not just about improving urban health, but is a critical route to achieving global health as well. As a foundation and through Impacting Urban Health, we take a test and learn approach to understanding what the solutions and the system levers are to improving health in urban areas. And we want to learn from what we do and share that with other cities around the world because we think there's lots of sharings to be had. So to answer the question on what we're doing to help transform urban environments, as a 500 or 800-year-old foundation, depending on the sources, we have the independence and the financial wealth to invest the time and resources into tackling health inequalities for the long term and achieving our ultimate aim, which is a big one with others, of global health. But we do this by listening, understanding what works best and what doesn't work, and really trying to back innovative solutions and ideas that help us to understand what is needed to actually achieve that goal. So with that being said, before I get into some of the projects that we have funded, I want to talk to you a little bit about what our insights and learning that we've gained from the work that we do in our place has enabled us to invest in, and why we invest in those things. So, like I said, we've been around for a long time, but over the last 6 years, we've changed our strategic focus to really look at our place, which is 2 boroughs in Lambeth and Southwark, which are very similar to lots of other urban areas across the world in terms of the density and population, the economic wealth or poverty in those places, in that small place, and the ethnic and cultural diversity that sits in that place. And we've got 4 programs that we look at that really try to help us to understand what are the system levers and drivers. So we focus on childhood obesity, multiple long-term health conditions, the health effects of air pollution, and child mental health, to really understand what, because these programs or these issues are relevant not only to our place in Lambeth and Southwark, but are globally relevant as well. And it helps us to unpack the system. Over the last year, we conducted 3 reports. One was our global perspectives on health. So whilst we are in London and we are comparable, so we looked at other cities across the world that were same as us in the boroughs. Our global perspectives report on urban health aimed to look at similar cities and neighbourhoods to get us to understand what are the similarities in urban areas across the world. What are the things that people are doing well that we can learn from, but we can also share from each other? During the time we were doing that, we started that in 2019, 2020 happened and COVID struck. And the pandemic was a real practical demonstration of what and how health inequalities and inequities impact society as a whole if left unchecked. And we took that time to galvanize lots of different people across the world, in the US, the South, and the UK, from commercial sector, third sector, public organisations, to find out who were working at the coalface in that time, to find out what they were doing to react to the COVID pandemic, what lessons that they were learning, and collating all of that to kind of really understand what the workable solutions were to health inequities and how you try to understand what the barriers are for that. During that time, we also looked at we worked with the London School of Economics and our community researchers to think about, if this is what we are dealing with now, how do we build back an equitable future centering health equity at the center of that in the recovery. So we were able to, in that time, not only support our communities on the ground, but to also look a bit forward and broader to find out what were the solutions, what were the insights that we gained through this time, so that we can help and share with other people. And that informed some of the projects that we did and we continue to do. So I forgot to change my slides. So the research, along with the insights gained from our other programs of work, gave us a number of takeaways that we've been able to help inform who and how we invest in people and initiatives that we support in terms of developing solutions going forward. So in the importance of looking forwards, who we work with, what we fund, and how we ensure that we're measuring structural change and holding people accountable to the results of health equity and the partners that we work with is really important. One of the important lessons that we learn. Looking at anchor organisations, they were the ones in the pandemic and in our communities who have been there for a long time, who have the knowledge and the understanding of our communities and have been working with them. And through the pandemic and through all the time that they've been in those communities, have been really investing and working with communities. So the process of building health equity must be equitable, and understanding and valuing the knowledge that communities hold in the long-standing trusted institutions is one we have to engage and build on the solutions that they're already applying and already hold. The third one around how we are working to shift approaches to community research and engagement, how we value and engage with the insights that those who are actually disproportionately impacted by poor health outcomes can work with communities to develop and inform solutions. And then the last one being collaboration, which I think everyone has spoken about here before, is tackling health inequalities will depend on cross-sector collaboration and responsibility, collective responsibility, understanding that we as a foundation and all of us in our separate parts are not the only part of the story and not the only solution, and that we are here for a particular space in time, doing a particular piece of work and building towards an equitable future. So that working collaboratively for the longer term will help to reap longer term benefits and that are more sustainable as well. So an example of one of the practical solutions or practical projects that we did during COVID was that we, as our research identified, that anchor organisations were important and best placed to support residents' needs, but they had also suffered from underinvestments in communities that were underinvested and under-resourced, but they were crucial to the successful delivery of COVID and for health equity in spaces. We gave unrestricted funding to organisations that were in our place. We allowed them to continue to do their work, asked nothing of them, but gave them money to continue to deliver in their spaces, with the aim that we wanted to support them through this crisis, understanding that they were underfunded, so that when we came out and we were looking for recovery and we had those organisations still available to work with us, to help us with the solutions and the repercussions. So that's about the collaborative working, investing in communities who know and are best placed to address the needs of the spaces that they're working with, and giving them the freedom to do that through unrestricted funding. Another of the things that we learned through our research is that there are people in environments that hold the levers to shift in change. But also, if we're trying to really shift the balance and really trying to make an equitable health outcome, we really need to focus on those who are disproportionately impacted, that their voice, their understanding is heard and is able to deliver services and influence the services that are delivered on the ground. So our research also showed through the COVID recovery, but also in our place, that health outcomes are factors of structural inequality and in many places, structural racism. And in particular in our place, that focused on Black communities who were not disproportionately impacted by poor health outcomes. So we've invested in a program that helps Black leaders to sit on boards and the highest decision level makers, structures of organizations that are responsible for the environments that can impact health. So these are like housing developers, these are service providers, these are public sector organizations. And we also support those organizations on their equity journey. So how they're looking at their organizations to unpack their structures and make them more equitable so that the leaders and the minoritized and marginalized groups that are influencing in those organizations are able to flourish. The aim here is to ensure that people who are most affected by poor health outcomes are able to shape the services that can protect health by placing them in decision-making roles in these organizations and ensuring that these organizations are dismantling their own inequitable structures to ensure that this is embedded in future sustainability. So, change the slides. So, all this is to say that when we think about transformational changes within the urban environment, there's only so much that we as a foundation can do, or any one of us in each of our separate parts can do. And this is a little diagram that I use. It's quite a good coaching tool, and I use it with my kids sometimes when they come to me with problems. But it's about looking about what is within our power and control, what is outside of our power but within our influence, and what is outside of our power and our influence, and really understanding the ecosystem within our cities and our neighbourhood or the health equity sector, and seeing what we can do and who are those others that sit in those other remits that we need to work with and collaborate against or collaborate with to ensure that collectively we're drawing in the right direction and drawing on each other's benefits and strengths to help achieve global and local equity. That's me.
Thanks, Rowena. I really love that. I mean, you can't do everything, right? So I really appreciate that unique perspective and approach that you're bringing to, specific London neighborhoods as a place to really invest. And I think that's a really, innovative idea to invest in collaboration as well as infrastructure. And, by building those relationships with the anchor institutions and focusing on those that need the most support. And then, learning from those and finding transferable lessons that maybe other neighborhoods that are facing similar challenges could also use. You're very focused. So I think it's a great opportunity for us to think about how we can learn from those, very focused approaches and those neighborhoods. So thank you so much. Louise, we have next. She is a health and community expert at Gehl. She's driven by a strong wish to address pressing challenges in society using a people-first approach in urban development and planning. And as a strategic thinker, she strives to understand the incentives for change in the various projects she engages in. Very interesting background as an anthropologist and health and community expert. She's responsible for the development of new knowledge areas, as well as for the development of Gehl's public life approach. I'm sure many of you are very familiar with it, including survey methods that can suit different urban settings for various purposes, from analysis to strategic input to impact assessments. And in recent years, she's been working with issues like health and urban environments for early childhood development, similar to Anna's focus. And the role of public realm in innovative business areas. So Louise, tell us how you're advancing this work through urban development practice, and in particular, how you use people's everyday experiences to shape your design approaches, and how building test interventions can help you test and scale what works.
Thank you so much for the invitation to come and speak. Really excited to be in a room full of so many different professional disciplines. And yes, I have a background in social anthropology, but I've been really interested my whole life in how to make environments for people to thrive. And that's what I would like to talk to you about today. How to really put people at the center. How can we do that? And inform our interventions and solutions with that focus. So the way that we address that at Gehl, how do we try to bridge this realm of urban planning and public health is really trying to understand the many connections between people and place. So using all the experiencing, the micro moments that people experience while being out. So when they move and spend time in the public spaces of a city, they form social connections. They are shaped by the sounds that they hear, the air that they breathe, the food that they have access to, the transport options that they choose, and all this affects their health and well-being. And this is really what we focus on. So how are these everyday behaviors? How are they shaping the connections and the health and well-being? And just to give you an example today of what that could look like, I want to talk about a concrete example of air pollution that has already been mentioned a few times today, and share with you a project example. So an important starting point for us is always to understand how people perceive these issues. And in the case of air pollution, we understand that an increasing number of people, they start to think about air pollution as something that they consider when they move out and spend time in the city. And in that way, also shaping their everyday experiences. So in one project that I did, I went out and I did interviews, and I talked to this mom, and she said, yes, now we used to live in a very dense part of Copenhagen, but when I found out I was pregnant, we thought we should move to this new development where the streets are wider and where there are bigger green parks, so our child could grow up in a cleaner environment. It just so happened, very unfortunately, that this was not necessarily a part of the city with better air quality. And I think that's exactly one of the issues with air pollution. It's such an invisible problem. And that's a great challenge. We have already heard all these alarming numbers that how it affects health, and even in the city of Copenhagen, we have high number of premature deaths related to air pollution every day, even though the levels are much lower than in many other parts of the world. Also, it's a very complicated and technical issue, because how to really understand and address air pollution. There are so many different types of pollutants and sources. So how can we deal with this problem? And all these pollutants, they act in many different ways. They're affected by wind and temperature, the shape of the urban environment. So how to make sense of this, how to align these people experiences and perceptions with this very complicated matter. The way that we try to do that is to really at start of every process to put people at the center, understanding the lived experience of the communities where we work, but also finding ways to make that invisible problem visible by connecting different data sets. And I'll show you an example of that, but also try to start action where people really are to make the case for more win-win. This is an example then that we did in collaboration with Google, Utrecht University and Copenhagen Solutions Lab in Copenhagen, and with the Bernard Van Leer Foundation. We started to think about how to combine different data sets. We, as a starting point, want to understand how people use and experience the city by collecting data on that. We then pair that with air quality data provided by the Google AirView car that has been driving around all streets, collecting air quality data at a very micro scale in Copenhagen, and to overlay these data sets, understanding who are really being affected. When are people out? Where do we see higher concentrations throughout the day, throughout the week? And what is, how is that correlating with where people spend more time and longer period of time? So could we try to think about these locations where we see higher concentrations of people with high concentrations of air pollution? And then moving on, thinking about, where to start, where should we really target the most vulnerable? So we could also see by mapping different city institutions like daycare institutions that we saw a very unfortunate pattern of daycare institutions being located just along the street with the worst air quality in that neighborhood. And we know that children are the most vulnerable, and we've already heard that today. So can we start to think about both where to protect and reduce exposure where kids are and are being subject to bad air quality, as well as inviting those children to places of better air quality. While we, of course, want to, in the long term, reduce emissions and lower air pollution, can we also, meanwhile, think about these different strategies? That led us to a concrete project funded by the IGLI Action Fund, where we wanted to test public space interventions. This is in a neighborhood of Copenhagen called Ørestad, one of these new development areas, where we actually saw quite high concentrations of air pollution. But we also wanted to understand where do people spend time. And one of the places was this bus stop, not just number of people, but also the time spent. So people would wait up to 10 minutes. And in many other parts of this neighborhood, people didn't spend time long because there were other issues that prevented them from doing so. A very hard microclimate with a lot of wind, really made for an environment where people didn't want to spend so much time. So we did a quick test saying, could we redesign bus stops? We know that this is where a lot of people in this neighborhood spend time. So redesigning a bus stop that could help to create a better waiting experience while also reducing the exposure to air pollution. This was developed over a very quick period of time. It was built in 2 days, and a pilot intervention was up for 6 weeks, where we wanted to test what was the impact before, comparing data before and after. Testing both a green wall structure as well as a dome structure as a physical barrier made out of polycarbonate. So also serving this purpose of creating a more inviting waiting experience. And this is really where I see a lot of potential to do a lot more quick applied research and impact measurement, thinking about, at a micro scale, what can we also do? In this case, we saw a decrease in the PM 2.5 pollutants at an average about 4%. Comparing the outside of the green wall with the inside in these domes where we also had green plants. But at the same time, we also saw social benefits that from this being a place where people would just stand doing nothing, this became a social meeting place in the city because we created a different type of micro environment. And this is sort of the theory of change that we want to infuse and think about more. How can we, by starting small, by doing a lot more of these pilot projects, really create change at a large scale? By using data, but also really understanding what could make for places that people thrive more generally. And if we think about a city like London, where we have also worked with air quality, if we were to apply this principle on all bus stops in London, where we have this situation where we could draw back the bus stop a bit and create these micro spaces, we could actually reach many millions of daily riders per day. So I think that would be my urge to really start to think, start small and think large as a way to drive change. Thank you very much.
Thank you so much. I love that so much. I mean, it's it's pretty novel, actually, even though it's kind of crazy that you're thinking of people and that theoretic or the applied research and sort of getting out of the theoretical models. You're actually seeing combining these data sets and looking at how people actually use the city. And for example, in this case, what air pollution they really are exposed to in their everyday life. I mean, why aren't we all doing that? It's pretty crazy, actually, that we're sitting there often thinking about these models and we're imagining what it might be, but you're actually looking at it. So I just think it's a great example that we could all learn so much from. Thank you so much. So last but definitely not least, we have David Erickson. He is a senior vice president at the Federal Reserve Bank of New York. He has convened thousands of experts to be speakers at conferences and authors in a series of books on how community development finance can work with other social investors to create more opportunities in low-income communities. And key to this strategy is to create new alliances with sectors that previously did not work with anti-poverty activists, such as health and climate adaptation, household financial well-being, really important, art and artists, faith communities, and others. And throughout, he is focused on how quasi-markets can be tools to create better social outcomes, which is the subject of his first book, Housing Policy Revolution, Networks and Neighborhoods. David has a PhD in history from the University of California, Berkeley. Look at that, alums on stage together, and a BA from Dartmouth College. So David, take it away from your really unique and fantastic approach at the Federal Reserve Bank of New York.
Thank you. Thanks very much. And what a thrill to be here. And I'm gonna, because I'm an older person, I'm gonna take my notes out that I use something called a pencil on a piece of paper. So that's, but it is tough to be in the central banking business these days. We're kind of the bad guys at the moment. It is pretty brutal what central banking, in fact, Janet Yellen was my boss many years ago in the Federal Reserve Bank of San Francisco. And she said, you know, what we do is pretty brutal, that we make money so expensive that it slows the economy down. And then people are, they're forced to take jobs at lower wages. And that's how you fight inflation. And so there's something, that's a really awesome and terrible process, but that I really want to just sort of emphasize that we're not all bad people, you know, like we really do care deeply. It's sort of taking the medicine in a way to sort of avoid a worse outcome of runaway inflation. But one of the things that we have learned over the years at the Federal Reserve is that, you know, the macroeconomy is really made up of many microeconomies, and too many of those microeconomies are struggling. And so my group was created about 25 years ago to really study low-income communities, how they function, what are the barriers that they experience from participating in and benefiting from the economy. And so we call that community development in Federal Reserve, but most central banks around the world have this function. And so I'd really encourage you to think about central bankers as a partner, because we know that health and wealth are really tightly connected. I'm going to give a few remarks here based on a book that's coming out in a few weeks from the Brookings Institution Press, called The Fifth Freedom, Guaranteeing an Opportunity-Rich Childhood for All. But I've got two quick disclaimers to make. One is that my comments here today in no way represent the views of the Federal Reserve Bank of New York or the Federal Reserve System. This is just me, David, talking to you. So thanks for having me over. And also, I make no money on that book. So I want to be clear, because I feel like there's so much bad behavior these days around self-promotion. And I think the book is important, but I certainly am not going to benefit from it financially. So I'm going to try to summarize the book in 4 headlines. And the first headline is, we were wrong about what we thought improved health. So the old theory was there were 3 things that improved health: good medical care, good genes, good behavior. So it turns out each one of those is wrong. We know, for example, from studies done in the United Kingdom, that before and after access to universal high-quality medical care, the health disparities, the health inequalities that existed before that still existed in later periods. So the Black and Atchison reports done in 1980 and the late 1990s show that while the country is marginally better, access to medical care did not close those gaps. The idea about good genes, we know through, and this group that knows all of this stuff, but epigenetics is really what sort of revolutionized our understanding about that. And in essence, your environment can overwhelm your genes. I mean, that's the bottom line on that. So if you are in a rough environment that often turns off good genes, turns on bad genes, it really can affect your health in a more powerful way. So good genes doesn't get you out of danger either. And good behavior, we've almost never been able to sort of to have interventions that were successful in changing people's diet, exercise, smoking, et cetera. So we know that those three avenues are really dead ends. So what does work? Well, we had a breakthrough in the 1970s with a report by Michael Marmot on what's known as the Whitehall study. And what really identifies is that in the British higher social service, there's an increase in health at each step as you go up the hierarchy. And the kind of the bottom line here from that study was that there's a sense of control over your destiny that tends to sort of impart better health. And we've known this, that concept has been studied many times. And in fact, I think it's really beautifully summarized by a mentor of mine at Berkeley, Len Syme, who's epidemiologist there, talks about hope. The sense of hope is really what improves your health. And because when you have hope, you make better decisions, you feel more optimistic about your future, things start to fall in line. So, okay, this is the second headline. Health happens in neighborhoods, geography matters. This is why hope and the sense of control tends to land in neighborhoods, because too many neighborhoods are lacking opportunities and have too many obstacles to kind of realize that sense of control. And so that's why, the Robert Johnson Foundation made this this one observation really universally known in the United States, which is your postal code is more important than your genetic code in predicting your health. So where you live really matters. And we know that that's an important part of this story. So if we're going to create neighborhoods that really promote health, and we think then those are neighborhoods that engender a sense of control over your future and a sense of hope, then we need to really focus on sort of how that happens, how you can make that happen. Many of the elements we've talked about on this stage so far are elements of that, whether it's investing in neighborhood, in community voice, in creating opportunities for people to gather, to sort of use data to drive some of the interventions. We have been talking about that sort of all morning, but in my mind, there's a population health model, business model that can make this work. And that really it consists of any market has to have 3 sort of players, 3 actors. First are the buyers of health. The buyers of health in this population health business model are government, health insurers, foundations, and social investors, people who are willing to sort of take a slightly reduced market rate return for investing in something that they think will have a good outcome. The producers of health are anybody who can sort of engender that sense of hope, who can kind of give that sense of control over your destiny. So those are affordable housing producers. They are what I kind of break them down in the book are guardrails and airbags. So the guardrails tend to be things built in the environment: good schools, libraries, affordable housing, transportation, access to a well-paying living wage job. And then there are airbags. These are sort of interventions that happen sort of, in the time when you need them in order to sort of kind of help you get back on your feet. So this might be counseling if you've been experiencing depression, or it might be a drug rehab program if you've had an overdose, or it might be tutoring if you're struggling in school. And so these things, the guardrails and airbags, are producing health. And then they're the connectors, right? And a lot of times that can be a bank. It can be in the United States, we have something we call a nonprofit bank called a community development financial institution. But there are lots of different ways in which you can connect the buyers of health to the producers of health in a more productive way. And I would just say that this is a very big marketplace. If you were to sort of think through, in the United States last year, we spent $4.4 trillion on medical care. 85% of that is on chronic disease. Most chronic disease is avoidable. Most chronic disease is avoidable. It takes place in low-income neighborhoods. And so we estimate that it's up to $1 trillion a year is spent on medical care that's the byproduct of living in a neighborhood that doesn't promote your health. And that just seems wrong to us. We think we can spend that $1 trillion upstream to make sure that disease never develops in the first place. So, and there are allied markets that can be drawn into this as well. So there is about $1 trillion that the federal government in the United States is now spending on climate adaptation, most of it going to low-income communities. But that's not just that's not something that's just happening in the United States. This is a worldwide phenomenon. There's about $30 trillion now under management in what we would describe as environmentally sustaining investing. That's a source of financing that could be in that buyer category. And so the trick then is to try to figure out how we can make this market come together. And I think that, one way to start is to find some place where someone owns the downstream medical care cost risk, and they can start making investments upstream. So one of the chapters in the book really focuses on Hawaii, which is a beautiful place to visit, but it has some pretty daunting health challenges. And increasingly, you're starting to see health providers invest in preschools because they know ready to learn at the start of school is one of the best predictors of future health. And so I think there's a way to organize that sort of market that values health. I think there's trillions of dollars available to do that. And I'd love to get into more of discussion that with you, either on the panel or maybe in the course of the day if I find you somewhere in the halls. But it's $1 trillion is a lot of money, by the way. I'm not a math guy. My PhD's in history, but that's $1,000 billion. That's a lot of money. So I think we've got some resources to work with. Thank you all for coming today. Thanks for getting up early, and great to see you.
Thank you, David. Well, I'm also so glad that we had you over. We really appreciate it. And great to know that central bankers can be a great partner. It is so important. And I think sometimes we forget that, and you all are able to do so much. So, we've had so many great conversations already, from the group talking about their work. We've unfortunately run out of time for the bigger, longer conversation that we were hoping to have. I hope we can have that over some coffee breaks or some drinks later together. But so just in one word, I wanted to ask you all just quickly, what is the one thing that you want to tell all of the urban health advocates that are here today? What is it that they should take away in terms of, the most important thing that they should be focused on to promote better health and health equity and to transform urban environments to promote health? What is the one thing that we should be doing? David, let's start with you.
So when those of you who are doing urban health, you're creating value by reducing medical care costs. If you create value, you should be paid for it. So I think there's a market for that, and I would love to help you think through how you can get some funding.
Great. Thanks, Louise.
I would really encourage cross collaboration. I think we see a challenge in actually making the point to how to different financing schemes come together, and we need to show that also very concretely what that could look like.
I would say look upstream at root causes and seek to apply strategies that remove structural barriers to healthy choices rather than focusing so much on the choices at the individual level. And there's a role for technical expertise, but always in service of local capacity building.
Great.
And I will address my thoughts to colleagues who are not necessarily from the health sector, that are coming from all the other sectors that are so relevant to health, and that inviting them to see themselves as the real, actually, public health professionals changing, the life of, our populations.
I'd add to everything that everyone else has said, and also think about the who and the how you are partnering. So collaboration is really key, but who and how you are partnering with other organizations, and making sure that the way you work, as much as the thing that you do, is equity transformational and not inequity reinforcing, so that whatever outcome you're producing, you're not reinforcing the equity by way of doing it.
Thank you so much. So we are all public health actors. We are all going to be seeking to collaborate more across sectors and disciplines, and always thinking about what's happening on the grounds, the local situation, working with the local community members and the organizations that are there that know what they need. The community is the expert, and we're here in the service of them. But this was such a great conversation. Thank you all so much for sharing your thoughts, and really looking forward to continuing the conversation throughout the rest of the days here. Thank you so much.